everyone, and welcome back to our next SASCOG researcher interview. I'm Caitlin Martin over at VCU Health in Richmond, Virginia, and I have the pleasure of talking to Dr. Vanessa Jacoby today. And so, Dr. Jacoby, just start off by telling us who you are, where you're at, and a little bit about your research journey.
Okay, great. Thanks, Caitlin. It's so nice to talk with you today. I'm Vanessa Jacoby. I'm a professor of obstetrics, gynecology, and reproductive sciences at the University of California, San Francisco, UCSF. And my role in the department now is I'm the vice chair of research for our department. So that is a big part of my job right now. And what was the second part of it? My research journey? Oh my goodness.
Maybe
I've already flubbed the very first question. This interview is going to be amazing. Okay.
Well, just tell us a little bit about, what first got you started in research as an academic specialist, and tell us a little bit more about kind of what brought you to where you are today, especially maybe regarding the role that you just talked about, where I believe you are now in a position where you help mentor other faculty and other researchers in OBGYN.
Yeah, sure. So I'm a clinical researcher, and the way this started was really early on. Like when I was in medical school, I was really drawn to clinical research and took some time off in medical school to pursue research and did an MD with thesis. So even really early on, felt that my career path would include a significant proportion of it would be in research. When I was in residency, I realized I really wanted research to be a principal focus of my career, but it was challenging to think about the path for that because I knew I wanted to be a generalist. And for this audience watching, like, of course I want to be a generalist. Why wouldn't you want to be? And there weren't a lot of pathways that I knew of to get the research training and mentorship that I thought I needed to pursue a path as an academic generalist. So I was really lucky because it just so happens that at UCSF, where I was for residency, there is a partnership with the San Francisco VA, and the Veterans Administration has a women's health research fellowship, which several faculty members in my department had done, and I could see where their careers had led, and it seemed like a pathway that would be a good stepping stone for me. So after I finished residency, I did this 2-year research fellowship. That was an amazing experience because I was able to complete a master's degree in clinical research, where I learned so much about research methods and the conduct of research, was able to really connect with strong mentors in my department and outside of my department. And thirdly, was able to connect with other researchers at my institution who are at similar level and had similar paths that they were going to pursue. So that was a really great experience. And then when I finished that fellowship, I then was really grateful to be awarded a K-12 grant from the NIH through the NIH program called the WRHR, the Women's Reproductive Health Research Program. So that's a 5-year career development award where a big percentage of your time, 75% of your time, is protected to do research, get more research skills and mentorship, and really try and launch your research career. And I finished that in 2012. And since that time, I've continued to have about 75% of my time, or maybe a little bit more, protected to do clinical research projects. And I love it. I'm really passionate about conducting research. For me, it feels like a way to have an impact on care of the patients that I care a lot about in a really broad and significant way. And that's the primary driver for me.
Mhm. I can definitely relate to that, right? We all want to find that area of our professional lives where we're going to leave our stamp, right? Leave our mark. And for some of us, it's education. For some of us, research. Some of us, it's related to patient care. And some of us, it's all of that. And so I appreciate your eloquent description of how integrating research into a clinical career like an academic specialist in OBGYN is one route to have that. And so,
Yeah.
Dr.
Oh, sorry. Sorry, Caitlin. I'm a terrible interview. I'm so sorry.
Okay.
No, I was just gonna say, because I think for me, the other thing is that it's, as a generalist, the reason that I got so interested, one of the reasons I got so interested in research is there were just so many clinical questions that would come up when I was seeing patients that I felt like there's no evidence on this. There's nothing to guide me. I'm really just hand waving here in terms of counseling my patients. And that's what's driven me in terms of my primary content area of focus and what keeps me motivated to move on, because there's so many, particularly as a generalist, just to emphasize, like, to me, it feels like the portfolio of research in obstetrics and gynecology tends to be very focused on subspecialty areas, whereas areas that a lot of generalists care for, that are some of the most common conditions in obstetrics and gynecology, have some of the least amount of research. So I do gynecology research primarily. So things like abnormal uterine bleeding, uterine fibroids, vaginitis, pelvic pain. These tend to have a much smaller research portfolio than a lot of other areas. And thankfully, NIH has recognized this over the last 5 to 10 years, and there is some support for these areas, but I wish there was more, and I think there should be more given their prevalence in the population.
I 100% agree. And we as academic specialists in OBGYN really do have a very unique opportunity to get involved in research and advancing the evidence base that is the foundation for clinical medicine for women's health across the lifespan, just as what you spoke. So that's one of the reasons we're doing these interviews, is to try to motivate more academic specialists to get involved in research however they see that that's possible. You talked a little bit about on your research journey about the role of these kind of formalized programs, this research fellowship, the K-12. And I know from talking with you offline about your role now with helping trainees at kind of similar steps in their trajectories. Whenever I talked with others who are maybe at considering one of these programs or training things, for example, there's sometimes a little bit of angst of, well, I'm not really sure exactly what I'm going to do. People sometimes show a little bit of uncertainty regarding how's this going to look when I'm done? I don't really have it all figured out yet. What would you say to some investigators who are considering entering potentially one of these formalized training programs as an academic specialist in OBGYN who wants to remain clinically active like you are too?
Yeah, I would say we really, really need you. We really need generalists, academic specialists in general OBGYN in research tracks, because of what I just highlighted, that there's really underrepresentation of the most common areas of obstetrics and gynecology that we tend to be focused on clinically. There's a need for additional research to answer these key questions. So I would really encourage generalists who are interested in learning about research and pursuing research careers to follow that itch. Like, don't ignore that, and to know that there are many pathways where you can continue to be clinically active and build a research career. And we can talk about it a little, Caitlin, and we can get into it, but also I think a big theme is to reach out and connect with people who have pursued this pathway or have this type of job, to think about what it could look like for you, because it can look really different depending on how much research you want to do, how much training you have or do not have. So it's important to, I think, get guidance and talk with people about what it can look like for you. And just to say, I'm always happy to talk with people. People can reach out to me. There's many other SASCOG members that also I know are willing to connect with people, but I think there's all the way from maybe you're spending 20% of your time doing research and have one grant that you're working on as a research project, all the way to, the majority of your time is research and your grant portfolio is a lot larger. And then there's all variations in between.
Mm-hmm. Dr. Jacoby, you were talking a little bit about the unique opportunities that we as academic specialists in OBGYN can take advantage of in the research world. Can you give some examples of different settings where we can have that stamp or have that mark in the research world as academic specialists, and kind of the unique, perspectives that we can bring to those different opportunities?
Yeah, that's great. I definitely sometimes feel that OBGYNs might feel hesitant to pursue this research path or have research leadership at their university because they're not sure if it's appropriate to have a seat at the table. I think the exact opposite is true. I think it's so critical for people who focus on women's health, reproductive health, the health of LGBTQ plus people, to be at the table in terms of research, the direction of research, the lens of research, research administration, research leadership, because otherwise that whole lens is missing from the discussion. So a big part of my career has been focused on engaging with university and sort of beyond university activities around research. So for instance, I have a leadership role with our Institutional Clinical and Translational Science Association, the UCSF CTSI. I direct the participant recruitment program. So our program is charged with creating resources and infrastructure and tools to recruit across UCSF studies with a particular focus on recruiting underrepresented populations. And so I'm in a lot of meetings with stakeholders who are engaged in research at UCSF, and I'm usually the only OBGYN in those meetings, and I think it's really important to have that view and perspective, and that's why I would really encourage academic generalists to pursue this. That's why I would say we really need you in these roles. And also just to emphasize in terms of needing you in these roles, another huge area of need is for researchers from historically excluded groups to pursue research careers. And I would highly encourage, anyone who is interested in pursuing a research path to do that. I would just doubly encourage any researcher or any generalist from a historically excluded group to pursue a research path. And again, I'm happy to talk to people, happy to connect with others, because there is a weakness of our research is the lack of diversity of researchers in the field. And that's an area that I feel really passionate about trying to address. And so would encourage anyone who wants to talk about that to reach out to me.
Thank you for that excellent point. And also to echo what you were talking about before then about your roles that you can play kind of on the administrative side and the structure and the infrastructure side at your institution. I've noticed that when I've been in some of these meetings before, and I've also been the only OBGYN, sometimes I'm also one of the one or two clinicians in the group. And I've noticed that I have that unique perspective just as someone who is boots on the ground. I know how the hospital system works and the clinic system because I've traveled it between inpatient and outpatient, right, with my patients because I am a generalist and I can work a little all over the place. And I have this unique perspective that then I can bring that as a huge strength to the administrative side. And so again, harnessing these strengths that you probably don't realize you have potentially, right? You don't know your strengths sometimes until you're in the room and it's really evident. So another echo, I would say, to that academic specialist and OBGYN really having these opportunities to make some great advancements.
Yeah, and actually, it reminds me another way that academic journalists can get engaged who are, if you're a busy clinician, which most people are, who wants to engage with research. Another piece of that is a lot of researchers are looking for a collaborator with your expertise. So, for instance, I collaborate with a cardiologist. I've collaborated with people who do Alzheimer's research. I've collaborated with people who do osteoporosis research. So researchers often are looking for someone with expertise that you clinically have, and then want to partner with you, and you have, say, a small percentage of effort on their grant because of your expertise in pregnancy or in women's primary care or in gynecology, or that can be a really nice role and way to engage in research for someone who's a busy clinician.
Mhm. And it's also fun too, right? To be able to
Yeah, yeah,
dabble in both those areas,
yeah,
and it's something you know so well already.
yeah. And I'll just give a quick example also of the impact that you can have. So I think you and I agree, we've had these experiences where if you're the only person in the room with a lens, what it can do. So in the research enterprise, an example is uh, the last few weeks, we've been managing the impact of the Dobbs decision from the Supreme Court. Obviously, people have been thinking about this deeply, the impact on clinical care and education. I've been thinking about it a lot in terms of its impact on research. And so that bringing that lens institutionally has been able to help support researchers in my department and my institution who are amazing, who do research focused on increasing access and to abortion and the care of people with abortion. So we've been able to do things like change the IRB process for rapid review for post-Dobbs studies, provide some institutional support to recruit for post-Dobbs studies, and other mechanisms to amp up and highlight abortion research in this post-Roe Dobbs impact environment. And I think having a seat at the table has been able to bring that lens to the research infrastructure at our institution. And that's just one small example of where an OBGYN like you who are watching this can have an impact. So again, just highly encourage people to pursue it. Your voice is really important.
That's actually an excellent example for us to end on. And I will just echo that. I bet you the other people who are sitting at that table with you are even more appreciative having you there than you realize too, because our perspectives are appreciated most of the time when we're at these tables from people who really want to make a difference.
No, thank you, Caitlin. And thanks so much for doing these interviews. And again, I'm happy always to speak with people interested in research and would encourage people to pursue that path.
Well, thank you, Dr. Jacoby. This was amazing. And we look forward to seeing you later and look forward to also to hearing the next SASCOG researcher interview.